Hey everyone, how are you? Just gonna wait for people to log on before I start. Happy Wednesday. Happy first NP Live, Ask an NP Live this year for 2020. I realize I haven't done one yet this year. January went by so fast. I don't know about anybody else, but I don't know. It was a bit of a shit show for me. So, in a good way. Well, I'm glad February's here, but yeah, it would just, I don't know. So lots of people are starting to come on, which is awesome. So tonight we're going to talk about a few things. I got a lot of really great questions. And so there's a lot of variety in tonight's talk. The first thing, hi, Jennifer, I miss you. Thanks for joining in. Hi, Nadine, I miss you too. Hey, Stephanie, thanks for joining all the way from Ontario, from my hometown of Sioux Lookout. I miss Sioux Lookout. I miss my parents so much. I'm a little bit homesick, although I have no desire to go to Sioux Lookout in the middle of winter. But yeah, so let's start with I got a question about TMJ. So Sharon was asking me a question about, what could she do? So first of all, I want to talk about TMJ and what that is. And so TMJ is temporomandibular joint problems. And what that is the joints here, okay? So it's the joint and the muscles that allow our mouth to open and close, essentially. So it's our jaw and the muscles around our jaw. And you can get quite a bit of pain there from a variety of reasons. So when you have TMJ syndrome, it's pain, it's difficulty sometimes opening your mouth. Sometimes people have locking and clicking of the jaw, popping when they're chewing, and that can cause pain and not cause pain. But most people, when we're seeing them, it causes pain. It can cause headaches. It's actually really common in women between the ages of 20 and 40. And I think part of the reason why it's so common is that we carry a lot of stress in our shoulders and our necks and our face. And many of us clench and grind our teeth. And so Sharon was saying that she does wear a mouth guard, which is really important. TMJ is actually something that the dentists deal with a lot of the time because it has to do with the jaw and the teeth. But I do have some insights about that because lots of people come to me about that. And it's super, super common. It's incredibly painful. So it can be caused by grinding or clenching your teeth. It can be caused by having not very good alignment of your teeth. It can be caused by having a head or neck injury. It can be caused by other disorders. So people who have arthritis, people who have sometimes depression and anxiety because we're so tense, that can cause pain with our TMJ joints. Yeah, lots of people with chronic pain will have tension there because they have pain everywhere else, and so all their muscles tense up. When we think of, what do we do about it? Certainly anti-inflammatory drugs are helpful because there's inflammation there. Going to a dentist to get a panoramic x-ray, which is the x-ray that looks at the whole jaw, is really important to see if there's degeneration or arthritis in that joint. I'm glad that you went to the chiropractor. I'm sad that, that kind of made things worse. The problem is sometimes those treatments make it worse before it gets better. Massage therapy can be really helpful. So, having a really good head and jaw and mouth, they'll actually a really good masseuse who's comfortable will put their fingers in your mouth and really massage those muscles and release some of that tension in the neck and shoulders. The other thing that can be helpful is acupuncture. Acupuncture is a great modality for pain. And I know that you're in Sioux Lookout, and so you might want to reach out to Melissa Zarecki. I know she does some acupuncture. I also know that Minnie Canson does acupuncture, and that might be helpful. The problem with living in Sioux Lookout is that depending on who your dentist is, it's hard to get in. The other thing that I have had patients have to do is go for physio, especially if they have a difficulty opening their mouths. And sometimes you need to be referred to a dental surgeon. Most people don't need dental surgery. However, depending on if you can't open your mouth, I've had patients where they can hardly like chew because they can't get their mouth open because they've essentially have lockjaw because of it. So yeah, so those are the things. If you're not already taking an anti-inflammatory, you should, and you need to take it daily, and I would do it for 10 days. Yeah, so TMJ is really common because we're stressed, right? And so managing our stress is really important. Um, it's unfortunate in Sioux Lookout because there's a lack of providers. Craniofacial therapy might be helpful, physio, but those are therapies that are really difficult to access in Sioux Lookout. So definitely going to your dentist, getting the x-rays, seeing what their suggestions are, but certainly something you can do at home. I know that a lot of people are hesitant to take pain medication, but the problem is that, your body can't heal when it's in pain. And so, it's not ideal to be on it forever. Obviously, we want to treat the cause, but maybe it's time for a new mouth guard. Maybe it's not fitting properly. Really evaluating your stress and how do you manage that. So those are my thoughts on that. Yeah. I think I was just looking at my notes. I made some notes because I just want to make sure that I'm, answering people's questions. So the next question I got through a private message of somebody asking me about, food allergies and food sensitivities and how do you navigate that? And my first question always to people who come in and they're concerned about food allergies or food sensitivities is, I want to know what kind of symptoms are they having? Are they having, gastrointestinal symptoms where they're having diarrhea or belly pain or bloating? Are they having, constipation? Are they having hives or rashes? Are they getting oral swelling or itching of the tongue? Because I want to be able to decipher whether this is an intolerance versus an allergy. If it's an allergy, and allergies are, you get hives, any oral itching or lip swelling or facial swelling, you need to be going into the emergency room because you need to be having an EpiPen so that we can be able to figure out what you were in contact with. Certainly in those situations, sometimes going for allergy testing can be really helpful. Allergy testing is only really helpful to really test for the most common, most serious allergies. So the things that they're testing for from a food perspective are peanuts, sesame seeds, fish and seafood, milk, wheat, also tree nuts, soy, kiwis. Kiwi allergies are quite common, and kiwi allergies are associated with latex allergies. And so these are things that we're looking at because these people go anaphylaxis. And so every time you're exposed to something you're allergic to, your body will respond more quickly. And so we really need to be avoiding those things. Having sensitivities is a whole other ball of wax. And unfortunately, because of our diet culture, sometimes it perpetuates this in the sense that, we have, everybody, wants to be gluten-free or dairy-free or, this or that, or no nightshades or, on and on and on. And so sometimes we can get stuck in that spiral of the alternative realm, which has, which is good and bad. The reality is we don't want to be eliminating any food out of our diet, or I hate to use the word diet, but out of our meals. We want to be able to eat any of those foods. However, there are some people that are more sensitive to things like gluten. Like for me, I get an incredible bellyache. I'm very sensitive to sugar. I get a really bad bellyache and diarrhea and those types of things. And so, being aware of that, right, is important. it's not helpful to go for allergy testing for that. So what do you do? The first thing I suggest is do food diary, being really, really, um, you know, detailed on what you're eating, how you're feeling, whether you're having belly pain or fatigue or brain fog or headaches or whatever, and look at the patterns. The reality is that most of our diets are shit. I'm going to be honest. Most of us, we're not really eating whole diets, and a lot of our problems and a lot of the way that we feel can be improved by eating a whole diet, whole food, right? Going around the outside edge of the grocery store, right? Fruits and vegetables, whole grains, milk, dairy, meats, legumes. Decreasing the amount of meat we eat, increasing, those vegetarian sources or protein. It's just a really healthy way to live. If we're going down the aisles, we're getting into things that are chemicals, that are processed, that have, trans fats in them, lots of sugar. They're really not helpful. And so most people, if you just eat, and I don't mean just like that it's easy, but if you go to a cleaner diet, that if you are going to have some baked good, that you're going to make it yourself. Um, that's much more healthy than going to something that has a shelf life of 6 months to a year, that has, 20 ingredients with half of them chemicals that you can't even understand. So keep that in mind, okay? But what's really important is we have to be careful about our intentions when we're looking at sensitivities, because it really can exacerbate eating disorder tendencies of avoidance and bad foods and good foods and that. And so I caution people to really look at facts and look at the intentions behind why you're wanting to eliminate certain foods. Okay. And that's just a really quick version of that, because I could probably talk about that forever. Then, so doing a really detailed food diary, having somebody to go over that with you, the reality is there's a lot of things that can, affect our day-to-day lives. The amount of stress that we're under can cause GI problems. The food, obviously, that we eat, the activity that we do or don't do, how much coffee we're drinking, alcohol, the drugs that we're taking. So there's a lot of factors. And so sometimes it's very, very difficult. At a last resort, doing an elimination diet can be helpful. It's really difficult to do, and I don't know many people who have been able to do it successfully, because it requires you to go on a very bare bones, bland diet or meal plan for 6 to 8 weeks, and then slowly reintroduce one type of food at a time. It's not something that I think should be done without the supervision of a primary care provider or a naturopath or a dietitian. If you're really struggling with food, I really would highly suggest getting a dietitian on board to help you navigate that, because they are the experts. For me, I am not an expert in food and nutrition. And so it's really important that you surround yourself with a team of a multidisciplinary team that's able to kind of, look at your symptoms and really be investigators to see what we can do to assist you and guide you to make really healthy choices that are going to help come to the bottom of that. So I hope that that was clear and it wasn't too vague. But I think it's really important that, we're cautious about that, jumping into an elimination diet or jumping into making assumptions that certain food are good and bad and that we need to stay away from them, because unfortunately, the messages that we have around food and diet are very negative, and really can affect our the relationships that we have with food, whether we realize it or not. So the next, and so the person that asked that question, if this doesn't answer your question, just send me a message, and I'll try and clarify and be a little bit clear. If anyone has questions, don't hesitate to put them in the chat. If you have a question that you want me to answer, put them in the chat. I just have a couple of more questions that I'm going to answer, and so I can take a few extra questions tonight if you have them. The next question is, how How do I know if I have a stomach ulcer? This is a common question I get, but you know what? To be honest, it's not. In my 17 years of nursing, my 8 years as a nurse practitioner, I've yet to have a patient diagnosed with a stomach ulcer. Yeah, it's not very common. So there's two types of ulcers. There's gastric ulcers, which are ulcers in the stomach, and there's duodenal ulcers, and those are ulcers in the small intestines. And so when lots of people will kind of be curious if they have an ulcer, if they're having a lot of stomach aches and pain. And, some people, they're worried about their amount of stress and that causing an ulcer. There's not a lot of evidence to suggest that stress is correlated to stomach ulcers. It certainly can affect our healing, but we're still unsure about that link between stress and ulcers. There are two causes of ulcers. One is non-steroidal anti-inflammatories, so an overuse of, Advil, Aleve, ibuprofen, those types of drugs. They can cause bleeding in the stomach or of the lining of the small intestine, and we really need to be careful about that. The other is a bacteria actually called H. pylori. So H is a common bacteria. Lots of people have it in their stomach. It's spread through kissing, or drinking or whatever. Not everybody that has H. pylori in their stomach will end up with an ulcer, but they can have symptoms. So, generally when we think about what are the symptoms of an ulcer, people will complain of, fullness in their belly. They don't have to eat very much and they get full. They have reflux or heartburn. They have, after they eat, they get a lot of stomach pain. They have a lot of belching. They are burping or bloating. If they have an ulcer in their intestines, generally the pain doesn't come for a couple of hours after food, but actually eating makes it better, or taking an antacid makes it better. So those are certainly nausea and vomiting can be part of it, but that's generally more of a severe sign. So vomiting and vomiting blood is a severe sign, obviously, of a GI bleed, and that's or an ulcer. Blood in the stool is generally, if you have an ulcer in the intestines, you'll have black stools. And so if you have a change in the color of your stool, we want to be able to assess that. How do we diagnose, an ulcer? And when someone's coming to me and they're having, kind of chronic belly pain that's really not getting better, the first thing I want to kind of rule out is this related to their gallbladder? Or their liver. So I'm going to do a little bit of blood work. I'm going to check to make sure their complete blood count is normal, because generally people with ulcers, they're losing blood, so they can be anemic. Their hemoglobin can be low, so the iron in their blood can be low. And so, I'm checking that. I'll do a test for that bacteria in the belly. And usually that test, it's kind of like it's a breath test. Sometimes depending on where you are, it can be a blood test. And then usually what I do is I prescribe something called a protein pump inhibitor, so a PPI, so something like Pantaloc or Losec. These are common medications that we'll use, and I'll put somebody on this type of antacid is the best way for me to describe it. And we do a trial of that, and we do that for 6 weeks, because that is generally what we need to do. I get people to come back in a couple of weeks. If it's not getting better, we increase the dose. We see where you're at. If that doesn't make it better, then I need to consider whether you need to go for a scope. And that's when they put a little camera down and they take a look at everything. I am concerned if people are having unexplained weight loss, if they're having difficulty swallowing or something called dysphagia, if they're having, if that belly pain is just regardless of the high dose of medication they've given, it's not getting better. The thing is lots of our foods can put us at risk for heartburn. So spicy foods, chocolate, caffeine, smoking, alcohol, lying down right after we eat can affect heartburn. And so these are things that sometimes we need to do diet stuff. So we need to take out caffeine and all those other things out of our diet to help. So yeah, so that's basically the treatment for it. If you have H. pylori, we do a course of antibiotics and we do that antacid. Generally, that kind of clears things up. Um, Obviously, if that's tests come back negative, we do the antacid. We stop the anti-inflammatory drugs immediately. Certainly, we don't want it to be to the point where you have a bleed, right? So you're vomiting blood or you're having a significant intestinal bleed where you're having black stools. And even in those cases, what are we doing? We're putting you on high dose PPIs, so these antacid drugs that help. And we hope that that's going to heal on its own. So the way that bacteria causes an ulcer is that it increases the acid in the stomach. It decreases the mucus. So our stomach, is holding acid and it has mucus around the lining, and that protects the lining. And unfortunately, this bacteria decreases that mucus. And so then the lining becomes exposed to the acid, and then the acid wears away at it. So yeah, so hopefully that answers your question, Jennifer. Hopefully you're still on. Let me know what you think about that. Yeah, so what Jennifer's asking is like if you have GERD, which is gastroesophageal reflux disease, do you have better chances of having ulcer? Well, yes, because you have, increase in acid, but gastroesophageal reflux is more that the sphincter at the top of your stomach is lax and it's causing acid to go up your throat. So it doesn't necessarily mean you have an increased chance of an ulcer. Certainly you can have an increased chance of Barrett's esophagitis or of esophageal cancers by having an untreated heartburn, actually. So it doesn't increase your chance of ulcer, because really the reflux is because the sphincter at the top of the stomach isn't tight and it's causing things to kind of go up into your throat. And so that's more of the reason. Yeah. So hopefully that answers your question. The other question you had, Jennifer, was about essential oils. Yeah, so essential oils are another one of those alternative kind of medicine realms, and I love playing with all that kind of stuff. I have to preface this by saying, none of it is well studied, and so but there's certainly things that make us feel better. I mean, I love putting peppermint oil on my back and my shoulders when my shoulders are tight. When I have headaches, I put it on my temples. Certainly, lavender has been shown to help people kind of calm down and sleep. Lemon, eucalyptus certainly is helpful when you have a cold. But I don't know much more than that. So I think that it's helpful. Certainly up north, we used to use a lot of oil of oregano for cavities, because when I was in the north, we didn't have access to a dentist. Certainly, oil of oregano has antibacterial properties, and some people ingest it orally. Yeah, so there's certainly, I think there's benefit of it. What exactly that benefit is, it's hard to say. I think you just have to kind of play with it. It certainly can be an expensive habit depending on how many oils and how many cents that you've invested in. So I always caution people, like, don't go broke on it. Certainly using it, with all the other modalities is great. I think where I have to limit some caution is when we are set against only using one modality and not looking at all the other things in our toolkit, right? I think that we can use alternative medicine, we can use traditional medicine, we can use it all together to be able to help things. And depending on what you're struggling with, we really need to be having a discussion about it just to make sure that there isn't something else we're missing, right? But certainly I love essential oils. I think they're great. And but at the same time, use them with caution. I mean, it's not going to cure cancer, it's not going to cure your asthma, but it certainly can help with your congestion. When you have a bit of a cold, a little bit of eucalyptus will open up your nasal passages. And if you have an upset tummy, peppermint can help. For me, it gives me heartburn, but for other people, mint can really help us upset stomach. Ginger can help. I think there's a lot of benefit of stuff that we really could be reaching out and using, in a very holistic way. So hopefully that answers your questions. Does anybody else have any questions? Just looking to see. Everybody's super quiet tonight, which is okay. This month is Heart and Stroke Month. So follow my feed for information about women's health, specifically around heart and stroke. Most of the studies that are done on heart health and stroke health are all been done on men. So 2/3 of the study have been done on men. And so, a lot of women are not getting the care that they need. So 78% of the time, women who are underdiagnosed for a heart attack because their symptoms are not typical of that of a man. So watch my feed for that. This week is National Eating Disorders Awareness Week. And so I've been posting a lot about that. Eating disorders are something that are very unrecognized in our society. We always really look at eating disorders as anorexia, right? So we're always looking for that super, super thin person. But, eating disorders affect everybody of all sizes, all shapes, all ages. Every ethnic diversity, male, female, transgendered, you name it. And so we really need to stop, fat shaming. We really need to stop, the language that we use when people have lost weight. Because that can encourage very negative behavior. Also making comments about or assumptions about somebody based on their size can be incredibly dangerous. So as a nurse practitioner and as, a primary healthcare provider, and my physician colleagues, we really are the greatest point of contact with people. And so I'm trying to post a lot of information about it, about eating disorders, because many people are scared to come forward. They're scared of judgment. They don't feel safe because we are in an environment that shames people's bodies continuously. And, it's difficult. It's a really difficult thing to treat, and people feel very much alone. And so watch my feed. I'm trying to post a lot of information about that. I am pairing up with an incredible organization called Bridgepoint, which is a center for eating disorders here in Saskatchewan. I'm really excited to be doing some work with them, some partnership and providing medical services. And I'm really passionate about this as someone who has struggled with my relationship with food, like many of us have. And so really, really trying to help with awareness and help people feel like they have a connection in their primary care provider. So the other things I'm going to be talking about this month is that it's Sexual Reproduction Month. It's Anti-Bullying Day at the end of the month. You're also going to see Human Trafficking Day. So there's going to be a lot of really interesting posts this month. I'm trying to post something different pretty much every day, depending on what's going on nationally and monthly. So just follow me for that. We'll continue to keep the Ask an NP Live every Wednesday at 7 p.m. I'm going to continue to do oracle card readings, but I've changed the time to 3 p.m. on Sunday afternoons because that works better for my family. I just thank everybody for tuning in and watching, and don't hesitate if there's a topic or a question that you have, don't hesitate to reach out at any time. It gives me an idea of what people are thinking about, and it gives me a lot of content for what I should post. And the next thing I'm going to be working on is Instagram. This social media stuff is crazy, but the next thing I need to do is Instagram. So you'll be able to follow me on Instagram as well. Anyways, I'm going to say goodnight to everyone, and I'm just going to see if there's any. Yeah. Judy saying, thanks for answering the questions. Yeah, you're a jaw clencher and having the same problem. Yeah, so am I. I've broken molars actually, um, because I clench my teeth so much, and so I thought my teeth were rotting out of my head, but it's actually I clenched my teeth that badly, and I just started wearing my mouth guard again because my jaw and my neck, and we get headaches from it, right? So it can be a big cause. So one of the things that I can suggest is the way to decrease the tension in your jaw is wiggling it back and forth like this. It breaks the tension here. So physiotherapists that specifically work on jaws, they'll tell you to do this, which kind of looks funny, but it's an important thing to kind of remind yourself, especially when we're at the computer, or at work, because we do tighten up like this. I think it's just our general society being overstressed and overworked and underappreciated. So thanks for tuning in, everybody. Don't hesitate to contact me, private message me. Let me know what you want to see on the Facebook page. I really want to make sure that people are engaged and are getting the information they need to really, be healthy and find wellness and happy. So anyways, take care. See you later.